Hi guys, it's me again. So we are here with Chapter 2, Models of Abnormality. And what we're going to do is we're just going to do a brief overlook of this. Okay, so we have the biological model and we have the psychodynamic model, the cognitive behavioral model, and I talked to you a little bit about that in the first chapter, one of the ways that we talk with and help folks who have addictions or mental disorders. The humanistic existential model, I'll talk to you a little bit more about that. That's one I'm personally a very big fan of. And the social cultural model, it's a family, social, and multicultural perspective. And then I'm not going to cover that one so much, but I will cover and talk about the others. And then the one that that is a big fan of mine and most counselors is the integrative model, the development of the psychological perspective. And basically what we're doing in that is we're taking bits and pieces of all these others that we just discussed, and we're making a more tailored approach for therapy for our clients. So that's what I really like about that. And I will do that a great deal when I'm doing family counseling, because you're going to have some of the same issues, but you're going to have different issues because you have individuals there and you have these relationships with these individuals to each other, and then as the family unit. So it's very interesting, but it can also be very difficult to navigate that. And especially if you were using just one way, that's why that tailored approach and the integrative is the way to go. So we don't call it that, but it's kind of piecemealing the therapies and getting the recipe that works for the clientele that you are working with. Okay, so now I am on page 37 of your text if you want to follow along, the biological model. So basically, what the biological model is doing is it's looking at those parts of the brain, and you're going to see them in the diagram on 37. It's going to be pointing at the different parts of the brain and talking about that. And so what you're going to do is it's made up of 86 billion. We'll go into the biology part of it a little bit. Cells. Okay, these are nerve cells, and then they're called neurons. And so there is, at any given time, there's so much going on in your brain. And what happens when these folks have these abnormalities is there's something that is going on, being triggered or not being triggered correctly in the brain. They may have a serotonin level too high or too low. It's all about that brain chemistry, especially when we're talking about biological perspective. So if you want to go a little bit deeper into the brain anatomy and into the brain chemistry, then page 37, and I believe that goes through page 38, and it'll really go a little more in depth on that, and it'll just explain that a little bit more, and talks about the neurons and the synapse and the neurotransmitter and the receptors and how all that just pulls together and works or doesn't work. Okay, so excuse me. And hormones, it even gets into the hormones, the chemicals released by the endocrine glands and into the bloodstream. So a lot is going on up there. It really works to help the whole rest of our body. So a lot of times they'll look to what's going on in here to figure out what's going on in the rest of us. So it all kind of starts in the head, whether it's negative thinking, because we know that when we talk to people that have maybe a lot going on, okay, whether it's medical or it's family, those that seem to have a more positive outlook, they just seem to do better. And that's coming back to that positive psychology. So it's a lot of what we tell ourselves. There's a lot of what we call stinking thinking. And what we need to do is make sure that we're running those out and putting something more positive in there, because we get a better outcome. And that's what happens a lot of times. People get with whatever's going on, they get very bogged down in a lot of very negative thinking. And even if you have some awful things going on, if you can find something positive about it, or you're looking at it from a more positive approach, people just get better outcomes. And that's a lot of what we do as counselors, is we help teach people to come at their problems or their negativity from a more beneficial standpoint, a more positive standpoint. And when we're talking abnormal, sometimes we can't do that unless we have their chemistry right. And that's when we talk about the cognitive behavioral therapy. And it hits on that a little bit in this chapter, so I'm mentioning it. At that point, we have to get them regulated chemically, and then the other can work. And so that's one time that just the talking will not work, because the chemistry is really off. But I'm talking more in terms of people who are coming from a more normal place. Is that it's really hard to be positive. It's easy to be negative, so we have to work on that positive. And that comes back into play with some of that positive psychology. Dr. Mark Selman coined that, and has done a great deal of work with it, and it's very good. Okay, guys, page 41. Okay, so we'll look at this for a second. And it has a lady on here with, I think that's a dog. It may be a cat. It's really furry. Depression hurts. And it is really getting into, depression. And, a lot of people are going to experience depression at some point in their lives. And it's very important, especially during this time of the year, because we have more of the SAD, or the seasonal disorder, happens during this time of the year. And people tend to get a little more depressed because they're not getting as much vitamin D. They're not getting any of that from, the sun, or they're getting less of it. So what I would say is, if you are experiencing some depression, I would talk to my doctor. And then I would look at vitamins first. Talk to your doctor about vitamin D3. Okay, that is one that most of us are deficient in, and it can really help other medications do better, or just even as a standalone, because a lot of times, a lot of what we have going on in here, or just general not feeling, enough energy, can be vitamin deficiencies. And those are very different, but they can also affect our processing. So that might be a talk to have with your doctor if you're experiencing anything like that, or someone who is. So now on page 40, I want to talk to you a bit about this, because it's something that we have seen in horror movies. The electroshock therapy, electroconvulsive is how they have it listed here, but a shock therapy. And this has been something that in the past they have used for all sorts of treatments, or what they called treatments at the time. What we would call them today is gross abuse to the patients. Because at one point, and I actually know a man. He is homosexual, and his parents had this given to him because they thought it would cure homosexuality. Okay, so things like that. And so we have come a long way. And I mean, we still have a ways to go, but we've come a long way. And we do still use electric shock therapy. And the way they use it now, predominantly, if we, the use that I know of, there may be other uses, but the one that I'm really aware of is when people have just horrible headaches, migraines, and nothing else has worked, sometimes that shocking of the brain will just kind of make that it kind of arrest that pain there, or causes it to reset in some way, and those patients have been helped by it, and they continue to do that upon occasion, but it's very shocking to the system, and the mental toll that it has taken upon folks that have had this and maybe did not want the treatment. It's caused a lot of other things to happen with them, and so it's good that we're not using that as a treatment for things that do not need to be treated, such as being homosexual. So, and just recently, this is something to be noted also. Just, I believe it's been in the last 15 to 20 years, homosexuality has been taken out of the DSM as a deviance, because it was still looked upon as deviant behavior. But luckily, we are not looking at that as a deviant behavior anymore, and that is a sign of the times that things are changing. And the DSM, for those of you who are not familiar with it, we are in the 5. I think we may be headed toward the 6 before long. What it does is it categorizes all of the deviant behavior and the disorders. And it frequently, from times, it updates it, and it may recategorize, or it may add a few items in there. So, give you an example. ADHD, okay, it's not actually considered ADHD. It's ADHD, but we have heard of, ADD. You have the attention deficit disorder. Okay, and a lot of times our girls in the schools, they would have that without the H, without the hyper component. But in the DSM, it is just listed as ADHD. So you have that hyper component in there. And that was why a lot of times our little boys got treatment and our little girls went unnoticed, because they both had the disorders, but the little boys had the hyper part, and they were more disruptive in the classroom. So that's one of the changes that is in the DSM, and from time to time they'll just do updates on that. So next, on page 43, you have the psychodynamic model, and anytime we say psych, you think of Freud. Psycho, think of Freud. Okay, and what I'll tell you about Freud is Freud had some very outlandish ideas, but he had some really good ideas that gave us a good basis to draw from. But what you've got to remember too is that Freud was during a very repressed time. And let's say, and what else was going on? We had Hitler happening, and Freud was Jewish. So there was a lot going on during that time. And when I talk about it was a very repressed time, I'm talking about with sexuality especially. And that was a lot of what Freud is based on, is a lot of the sexuality, or that's what stands out and resonates with us. But I want you to think about this. At that time, you had those beautiful Chippendale tables that had those beautiful Chippendale legs on them, very ornate. But now when they would dress those tables, the tablecloths had to go all the way to the floor. They didn't even show that beautiful woodwork. The tablecloths had to go all the way to the floor. And that's because they were so afraid that the leg of that table would mimic a woman's leg and cause a man to want to have sex. That's how repressed those times were. So I want you to think about things like that when you're thinking about Freud, and he is the father of psychology. So he had a lot of what would be very outdated thinking today, but a lot of it was very forward back then. And what I really like too is his daughter, Anna Freud. She was very big in psychology too, and she followed in her father's footsteps. So that would have been very forward thinking for the time to have a female predecessor there. Okay, so what on page 43, I'm just going to talk about a little bit of what Freud did for us. Okay, Freud came up with the id, which is the force that is instinctual. It's the needs, the drives, and the impulses. Ego, which is, according to Freud, is a psychological force that employs reasons and operates in accordance with the reality principle and the ego defense mechanisms. According to this theory, strategies developed by the ego to control unacceptable id impulses and to avoid or reduce anxiety around, that would arouse. Okay, so it's how we rationalize things. Rationalization is one of those. And okay, so the defense never rests. I want you to check out page 44, and I want you to look at those. And also, interestingly enough, I'm looking here, I'm not seeing if it's mentioned, but his daughter Anna helped come up with some of these. Okay, so I want you to look at that and become familiar with it. Look at it and see, now, which ones of these do I use on a regular basis? And some of us, if we have a little awareness, we can see this and we can say, okay, well, repression, okay? That's when a person avoids anxiety by simply not allowing painful or dangerous thoughts to become conscious. And then it'll go into examples. I'm not going to go into those, but I want you to go through here and read. Okay, denial. We know people that are in denial when we talk about the 5 stages of grief. And at some point, I'm going to talk to you about those in here. Denial is that first stage. Okay, we know that person, that maybe somebody has died and they're just not ready to accept, or they're about to die and they're just not ready to accept that piece of knowledge. So they're just saying, I'm just gonna not worry about that because it's not happening. Okay, projection. A person attributes his or her own unacceptable impulses, motives, or desires onto another individual. So a lot of times you may have experienced this, most of us have, someone else whose behavior is negative, or they want to turn, or if you broach them and you say, well, this is what I'm noticing, this is unacceptable, they might try to project it right back on you and make it about you because they're not ready to take that look at themselves. So projection is one that happens a lot. Rationalization, that's another one. And this is one that I think most of us have done often. So a person creates a socially acceptable reason for an action that actually reflects unacceptable motives. So we'll go ahead and use since we're in a classroom, we're going to go ahead and use the example for this one. A student explains away poor grades by citing the importance of the total experience of going to college, and claiming that too much emphasis on grades would actually interfere with a well-rounded education. Okay, and there may be some validity to that, but you have to have your head in the books and be learning. That's how you get the well-rounded education. Do you make an A every time? No, and that's okay. But the average needs to be, maintained. Displacement. Okay, so a person displaces hostilities away from a dangerous object and onto a safer place. So I'll give you an example, one that just breaks my heart, is if you have a child that's being abused by a parent, and the child is upset with the parent, and then the child is alone with the pet and he kicks the pet. That's displaced, because the pet can't do anything to him. If he were to take his anger out where he wanted, then his daddy would hurt him. So that's a good example of displacement. Intellectualizing. Okay, a person progresses emotional reactions in favor of overly logical responses to a problem. Okay, so a woman who has been beaten and raped gives a detached description of the effects that such attacks may have on victims. So she just kind of she's taking it off of her, and taking more of the emotions out of it. Okay, regression. So this is when a person retreats from an upsetting conflict to an earlier development stage in which no one is expected to behave maturely or responsibly. So they may regress back. So a boy who cannot cope with the anger he feels toward the rejecting mother regresses to infantile behavior, soiling his clothes and no longer taking care of his basic needs. So that's one sign. That's a pretty extreme one there, but they can regress. Okay, so Freud also came up with superego. This is page 45. And the superego, that is where let me just read this and it'll tell you. According to Freud, the psychological force that represents a person's values and ideas. Okay, the superego, the word for me that's not in here is where, you have the conscience, okay, and you're wanting to do right by other people. It's not the selfish like the ego, which is me. Okay, fixation. According to Freud, a condition in which the id, ego, or superego do not mature properly and are frozen at an earlier stage of development. So that can happen. So we talk about people who've been fixated orally or fixated anally. Give you an example, and this example may be a little bit dated here, but if you've ever seen The Odd Couple, there were two characters. There was an Oscar, and Oscar was a bit of a slob, and Felix, who was a bit of a he had to have everything just so. So he's very OCD. Everything had to be just perfect. So the two of them being roommates was quite the contrast, and it made for some very good entertainment. So, but what they would say about those two characters, Oscar, which is a slob, he would have been considered anal. No, not anal, oral. And the other, Felix, would have been considered anal. So and you did see Oscar very often. He would have a cigar. He smoked a cigar, and that depicts that that oral fixation there. So it was just very interesting to watch that. And it was funny because if you have watched Freud, very often he would be pictured with a cigar, and critics or someone, I'm not sure who, asked him what that meant. Did that mean that he was orally fixated? And he stated to them, sometimes a cigar is just a cigar. So I just always find that funny. 46, okay. Free association. Okay, psychodynamic technique in which the patient describes any thought, feeling, or image that comes to mind, even if it doesn't seem important. Okay, so sometimes that we will do that in a therapeutic setting and just let them just freely associate. And sometimes those items will have a hidden meaning, and then we kind of look at those meanings. Okay, resistance is an unconscious refusal to participate fully in therapy. And we will get that sometimes, and we'll see it with closed off behavior. Maybe they'll come in wearing a hat, or they got their legs folded, or they're doing this the whole time. You watch that body posture, and you can see it before they even speak, if they speak. Okay, so transference. This is what happens when they redirect toward a therapist. So, for instance, if someone if someone comes to me and they have problems with their mother, and so maybe they may transfer that on to me, and then that can be very therapeutic and very catharsis for them. And then what we do is we help them work through that. Maybe they say things to me that they couldn't say to their mother. Okay, so that's one of the ways that works. And dream, it's a series of ideas and images that form during sleep. And I'm giving you all the textbook definitions. I'm reading them to you. Catharsis is the reliving of past repressed feelings in order to settle internal conflicts and overcome problems. That is the buzzword right there. That's what we want to have happen. Working through. Okay, the psychologist or the psychoanalyst, processes of facing conflicts, reinterpreting the feelings, and overcoming one's problems. So basically, we're giving folks a different frame to look through and a different way to look at what's going on. Okay, so in chapter 2 still, page 48, assessing the psychodynamic model. So we're looking at that, and it's going to talk about conditioning, classical conditioning, the modeling, the operant conditioning, and what you're going to see on the opposite page, 49, the behavioral dimension. Is going to show a little boy here, and this is the Bobo doll. I'm not sure how much they're telling you about it, but basically what this is an experiment that was done, a Bobo doll, and these children were taking their aggression out on this doll, but it was a model behavior. They saw someone else do this, and then they mimicked it. If you see in the first photo here, they watched an adult do it, and then they did it. Okay, the next page talks about cognitive dimension, and it talks about conditioning. You'll see an elephant here that's been conditioned to sit on a stool. We'll get more into Pavlov and Pavlov's dogs a little bit later. The next page is cognitive behavioral interplay, and basically, what we have on here too is talking about the cognitive dimensions. You're going to see a little skit here that's done for patient and therapist, which is pretty interesting. So you'll want to get and look at this. Social anxiety disorder. We have a lot more of that coming in today, since people are all about playing with others online. They're not really getting out and communicating with people. And so this is what happens, and people start to fear social situations, and they're fearing them even more now in the case of COVID. So and then if you look at page 52, it talks about exposure therapy. And that's one of those therapies where we talk about if somebody's afraid of something, we slowly expose them to it. So like if they're afraid of spiders, what someone might do is start talking about spiders. Then they may show them picture of spiders, let them touch a glass that has a spider behind it, and then to the point where there's a spider maybe on the floor, and then in some cases where they actually have them holding a spider. That's kind of the way that works. Okay, so on page 54, they have this really pretty paper here that talks all about mindfulness. That's really pretty. I think I may have to just copy that and put it on the wall of my office. It's really nice. Mindful strategies, and just it's just a nice it's a piece of art, and it's helpful, so you might want to check that out too. So let's see. So I'll talk to you a minute about therapists. Rogers came from the more humanistic side. Carl Rogers. He believes in empathy without sympathy. So sympathy is feeling sorry for someone. Empathy is actually standing in their shoes. Gestalt theory and therapy. Gestalt is really good, and an example of something that is used with Gestalt. It's also a humanistic, as is Rogers. Is the empty chair. You've all seen someone talking to the empty chair or talking to the teddy bear. Then that basically is what that is. So that's really what that's about. And on 60, I want you to read into the social labels and the roles, and those kind of change through society. So I'm going to kind of just shift through here a little bit more because there was one other thing I wanted to look at, and then we're going to close up. Okay, page 66. I want you to check this out. It talks about poverty and mental health. And folks that experience poverty experience a lot more mental health issues. So that's something to really be noted, is that it has to do with what kind of treatments they can receive, maybe what kind of treatments their family in the past has received, because if they're in poverty, they've been in poverty a long time, and maybe their relatives before them, had some of these same disorders, because a lot of times this stuff is genetic, and if that went untreated, then progressively the folks tend to get worse. So look at page 66 and 67, and that's what that's talking about too. Okay, guys, so I want you to also to look at page 69 and comparing the models at that bottom table. And I hope you guys have a great weekend, and your key terms are on page 71, and it tells you all the different pages to look those up. So find something that you think is very interesting. I want you to read over all of this, but I want you to really do in-depth study on something that you find interesting. That will make this class more enjoyable. Thank you, guys. Have a great weekend. Bye.